Hello and welcome to yet another edition of your weekly international current affairs program, Globe Watch on the Cameroon Radio Television with me, Charles Ebune. The pull out from global health engagements by the Trump administration has stressed the global health security system, especially coming from the pangs of COVID-19, which eroded much of the progress made in advancing universal health care system. What could be the part played by the private sector in filling the gap, of course, created by the departure of the United States from the global health system through a pull-out from the World Health Organization and other funding mechanisms like the United States Agency for International Development? My guest today is the president of Swiss Supply Company. Marco Illy, welcome to Globe Watch.
Thank you very much.
You spent so many years working in the global financial sector. When you look at the global financial environment today, especially with the tariffs coming from the US, how do you think they perplex the banking system?
Well, I think the increase of tariffs is not a good thing. Because the world today functions with two elements. Capital, which is very mobile, on the one hand, and the need for investment opportunities on the other. Tariffs, any global restrictions on movement of capital is a constraint for global growth. And so therefore, here, what one is trying to do with the increase of tariffs, triggered by the United States, is really to attract investment into the U.S. But that is not, if you want, productive in terms of global growth, because it inhibits the flow of capital on the one hand, and it basically constrains investors from seeking attractive opportunities all over the world, such as, for example, in Africa, which I believe is the new global frontier for investment opportunities.
Sure, but for a country like Switzerland, your home country, which is basically a service economy and right, financing, and the banking sector stabilizes the economy, what do you think have been the fallouts of that on the Swiss banking sector in particular? I
don't think there will be any fallout for Switzerland. You see, in Switzerland we have a very small domestic economy. So very early on, we have invested abroad. We've invested in manufacturing abroad. The typical rule of thumb for Swiss industry is to invest 1/3 in Asia, 1/3 in Europe, 1/3 in America, or in the Americas. And so therefore, the demand that is created for our goods in the United States is produced in the United States. So Switzerland is probably one of the exceptions for being affected negatively by tariffs. As a matter of fact, Switzerland imports more from the United States, the Swiss economy, than they do export to the United States. So therefore, for us, it's not necessarily a worry. We very early on, came to the conclusion that because of the high cost of labor in Switzerland, it would be smarter to produce abroad and basically just retain technology, research, administration, and services domestically. I'll give you one example. One of the largest food companies in Switzerland, Nestlé, what they basically produce and supply to Switzerland is less than 1% of their total sales.
I'm glad that you talked about Swiss companies already, and one of the buoyant areas of your economy equally is the pharmaceutical sector. And here I'm talking about global health, and you know that yes, one of the latest developments too since President Trump came to power is this pull out from the global health system when we are coming from COVID-19, which eroded a lot of investments which had been done in this sector. what do you think is actually going on with the latest developments?
Well, you're referring to, if you want, the reduction of U.S. ID. That is affecting the ability of many NGOs to be effective.
Not only the closure completely of the United States Agency for International Development, but equally pulling out from the World Health Organization and other health needs like the Global Fund against malaria, tuberculosis, and others.
Correct. Well, look, I think, it is what it is. We will have to rely on private capital. There is a fair amount of private capital that can be deployed in continents such as Africa, even capital from the United States. So what you will be seeing is a replacement of, call it foreign aid from the United States being replaced by private capital. That private capital can be deployed provided the investment opportunities and the returns are attractive, which I believe they are in the African continent.
One of your post-Credit Suisse life investments is in the health sector. And you know that the world needs to invest roughly $10 billion yearly to stabilize global health provisions.
Correct.
Why did you decide to venture in the medical world, if you like, the health sector?
Well, as you may know, previously I was on the executive board of Credit Suisse Switzerland AG. During my tenure in that position, we did many investment banking transactions, mergers, acquisitions involving the healthcare space.
Including Novartis, which is one of the key.
Novartis, Ciba, Roche, just to name a few, Synthes, and so forth. And so when you do these transactions, you get to know the healthcare space very intensively. And so that's how I grew my affinity to the healthcare sector. I alone did 9 IPOs in the biotech sector. Today, I'm also, or at least until last year, I was on the board of Suisse, which is the healthcare innovation agency for Switzerland. So it's in my DNA, healthcare. And as a result of that, then we founded MSCS some 6 years ago. And since then, the business has been growing very nicely. We've already delivered 71 hospitals all over the globe. We have our manufacturing facilities in Turkey. We have subsidiaries in the United States, Switzerland, and in the Middle East, in Dubai, where we run our African business from.
You just spoke about the creation of medical supply company, Suisse, which you said you created 6 years ago.
Yes.
As one of the levers of your endeavors to ensure that there is affordable health care for millions of people across the world. What actually do you do at this company in which you are the president?
Our mission is really to what we do. We need to have an impact on helping governments improve their hospital density. Why are we so attractive to the African continent? Well, the African continent compared to others has probably the lowest hospital density, and there is an acute need to be able to improve the infrastructure to supply the basic needs for the population.
How much impact have you had already in other parts of the world? In a moment, we'll talk about Africa, where we need to invest roughly $4 billion in terms of health infrastructure yearly.
You probably need to invest more than $4 billion.
Absolutely, I'm just giving average picture.
But let me give you an example.
Statistics made available by the World Health Organization and other development partners.
I'll give you an example. With $100 million investment, let's say in the Republic of Central Africa, you can already cover the basic healthcare needs of 30% of the population. That is impact. So today, with modest investments, you can do a lot for the population.
When you talk of $100 million
dollars.
Oh,
yes.
okay, sure.
Yes.
That should be roughly 80 billion CFA francs.
Around that. That gives you just an example of how much impact you can have in Africa with modest investments, like I've just said in this particular example. Here, which brings me to our discussions with His Excellency, the Minister of Health, he proposed a very innovative project, which is the delivery of mobile clinics, which enable then the government to serve areas of the population that are in the rural areas, which today don't have access to healthcare or have to travel very long distances until you have the next healthcare infrastructure available. That is very commendable as an initiative, because you're bringing healthcare to the people which don't have access to that. And you're doing that with a very cost-effective solution, which are, if you want, mobile clinics.
You said a while ago that today we need to invest more in the health sector, especially coming from the private sector. The World Health Organization says that universal health coverage to meet the targets of the Sustainable Development Goals by 2030, we need roughly $371 billion each year.
That's correct.
By 2030. Do you think that the private sector, when you look at the map of the private sector investment and commitments to the health sector globally, especially in Africa, do you think that enough is being done by the private sector?
No, absolutely not. As I said, Africa has one of the lowest hospital densities in the world. That represents an opportunity for the private sector to come in. But in order for the private sector and private capital to come in and invest, you need political stability. But I can see the demand for investment growing day by day from all over, be that investors in Asia, be that investors in Europe, or be that investors even in the United States that have earmarked billions already now to invest in hospital infrastructure in Africa.
Vous êtes au Cameroun actuellement pour rencontrer les autorités camerounaises parce que vous avez un projet de ce que vous qualifiez les hôpitaux mobiles. Il me semble que c'est trop nouvelle. Est-ce que vous pouvez expliquer la notion des hôpitaux mobiles?
Oui, pour être précis, ici au Cameroun, c'est ce qu'on discute, c'est ce qu'on a discuté avec Son Excellence le ministre de Santé, c'est la livraison des cliniques mobiles. Ça veut dire c'est des structures mobiles qui sont équipées pour faire la diagnose des petites opérations, la distribution des produits pharmaceutiques, imagerie, et comme ça, disons qu'on arrive à apporter l'infrastructure de santé mobile à la population là où ils n'ont pas accès à l'infrastructure fixe. Par exemple, dans plusieurs pays en Afrique, la moyenne pour arriver à une infrastructure de santé pour se faire soigner, c'est 9 heures de voyage. Ça, ce n'est pas acceptable pour aucun gouvernement. C'est ce que propose, et là on travaille ensemble avec Son Excellence le ministre de la Santé, c'est juste adresser ce problème-là en apportant les services et les infrastructures de santé à la population avec des installations mobiles.
Et dans le contexte camerounais, la population dira nous avons besoin d'infrastructures sanitaires stables dans la durabilité. Vous proposez les hôpitaux mobiles ou bien vous voulez les cliniques mobiles?
Ça, c'est une première phase.
Quelle est la durabilité?
Bon, avec notre technologie, ces infrastructures, ils durent 30 ans. Alors, ça sont des infrastructures à longue durabilité. L'avantage aussi, c'est qu'on peut livrer très vite. Nous, on est capable, avec nos usines de production, de livrer une installation mobile dans 8 semaines, clé en main. Ça veut dire on arrive ici, après une semaine, on est prêt à performer la première opération. Ça, c'est l'avantage de cette stratégie. Au niveau, disons, global, la bonne stratégie de santé, c'est d'avoir une stratégie en étoile. Ça veut dire des cliniques mobiles pour pouvoir soigner les patients dans les zones rurales qui n'ont pas d'accès à l'infrastructure. Après, la deuxième vague, ça serait des hôpitaux mobiles où on peut performer toutes sortes des opérations. Troisième vague, des installations fixes, des hôpitaux préfabriqués. Et quatrième vague, renforcer le dispositif des hôpitaux de référence. Ce sont les vagues, mais je crois qu'il faut commencer par la première vague, ça serait des installations des cliniques mobiles pour pouvoir réagir vite aux besoins.
Quel sera le coût et qui va financer?
Bon, nous, on est capable de financer le coût d'une clinique mobile, ça dépend de la configuration, mais ça peut être 300 000.
Dans vos prévisions budgétaires,
oui.
La première phase, vous souhaiterez investir combien au Cameroun pour la réalisation de ce projet?
Ce n'est pas que question du total des investissements. Pour le Cameroun, j'aurais un budget de 250 millions de dollars. Mais avoir les finances pour financer des projets, c'est une chose. L'autre chose, c'est aussi avoir la capacité de pouvoir gérer les installations. Il faut du personnel qualifié pour gérer des grands hôpitaux. C'est pour ça qu'on dit, on commence d'abord avec quelque chose, un produit qu'on peut utiliser pour réagir vite aux besoins, surtout dans les régions qui ont vraiment besoin des infrastructures.
Est-ce que vous avez les zones de priorité?
Le nord-ouest, le sud-ouest, par exemple, ce sont des priorités du point de vue des régions.
Les zones en crise?
Par exemple, voilà, c'est ça.
Et lorsque vous avez eu les entretiens avec le ministre de la Santé, et je suppose peut-être les autres entretiens off caméra avec les autorités, quel est le retour que vous avez?
Bon, le retour, c'est positif. D'abord, l'idée de déployer des cliniques mobiles, c'est l'initiative de son Excellence le ministre de la Santé. Et moi, je suis enthousiaste pour ça, puisque c'est notre compétence de production. Ce type d'infrastructure mobile. Alors, je crois que c'est une situation gagnant-gagnant pour les deux côtés.
And what do you have in that your plan to ensure that the infrastructure that you put at the disposal of the government, just like you are operating already in the Central African Republic and in other parts of the world, you said Turkey, who manages them?
Well, look,
and how are they maintained?
That's a very good question. Our philosophy is a 360-degree partnership with the government. That means we help manage the infrastructure, we help maintain the infrastructure, we help train the personnel. Just take the example of maintaining healthcare infrastructure. If you're in a hotel like here, and the elevator breaks down, the clientele gets very upset, especially the ones that live on the 11th floor. If you have life-essential equipment that does not function, that could be fatal. In other words, you may not be able to treat patients during critical phases. And so therefore, maintenance of equipment is very important so that it remains functioning properly. So that is our 360-degree approach to a partnership with the government.
In a moment, the interview will come to an end. When you look at the map of the world today as an investor in the health domain, what do you think is the most pressing health need globally and maybe regionally in Africa?
I think
infrastructure or pharmaceutical supply?
I think both. You need primary health infrastructure. What is that? That is the ability to diagnose sicknesses. If you're not capable of diagnosing sicknesses early, that's what can lead into a pandemic disaster. Okay. And so therefore, having these health posts, primary health care centers, mobile clinics that can perform diagnosis and very early on identify the potential of a disease outbreak, that is probably the most important thing. Once you have identified, the potential of a disease outbreak, you need the supply of medication.
Okay.
The supply of medication is one of the things also that can be improved in the African continent because it's very patchy. So therefore, as part of our partnership, we do make sure that the supply of medication is always available, and when parts of the medication falls below a strategic level, that automatically these stockpiles get replenished.
After 6 years of operation as medical supply company Swiss, what do you think has been your greatest achievement, and what do you intend to do in the years to come?
Well, I think our greatest achievement is, with our type of technology and infrastructure, is delivering to countries infrastructure that falls within their budget, is cost effective, and has a great impact, socioeconomic impact on the population. Be that employment, be that the ability to treat many more patients within a given budget. I think that's what we're doing very well. We've done that very well in Asia. We're starting to do that very well in Africa. So that's our greatest achievement. Looking forward, I think there's much to do in the African continent, and that's where we will focus.
And with that, we conclude the interview. The president of Medical Company Supply Swiss, thank you very much indeed for being guest on GlobeWatch, and I equally wish to thank your Cameroonian partner and representative, Pastor David Pem, for enabling this interview to be realized. Thank you very much indeed for being my guest.
Thank you very much.
You're welcome.
Have a great day.
Gracias.
De nada.
The Africa Workers and Amateur Sports Organization was established in 2001. That should be roughly 24 years ago, precisely on the 25th of April. What was the need when we already have so many other sporting associations on the continent?
Yeah, the need was to organize and well-manage sports at the workplace. Initially, sports at the workplace was done without, as a part of the leisure time of workers. Now things changed. But now sports at the workplace is a kind of mix-up of competition. Competitiveness. It is sports for all. It is. It has to see with leisure, managing leisure times of workers, but also a fact of socializing, of building, of team building, of cohesion at the workplace. So this became something important. It is more important than it was in the past.
You said that it's to socialize people, bring them together. On the continent, we have roughly 500 million people who are working in, be it in the public or private sector. Concretely, what have you people done in the past 24 years or so that you have been existing? You are operating from Cameroon with headquarters.
Yeah, we have done a lot. We, first of all, when it was organized in each country, it was not organized such a way that we have national associations. Now we have national associations. We have something about 25 national associations, 25 active national associations around the continent. You know, when OSTA started operating, we had 8 national associations, and now we have 25. If you make 25 minus 8, you see how things are.
You have expanded.
Yeah, indeed.
There has been growth in the association.
Yeah, indeed. The growth is visible, and the activity is organized by these associations too. So in each country, member country, it is also better organized. You know, in the past, it was, like I said, just an initiative taken by 2-3 employees in a company, and that's all at the time maybe of the Labor Day, most of the time.
On May 1.
On May 1, and now it is not the case. We have a championship, we have championships, we have sports worlds. We have also training programs for those in charge of handling all this in these countries, in these companies, and things are professionalized now. And I think we've made a lot.
The African Association of Olympic National Committees, of course, do recognize you, and you equally said that now you have championships. How do you organize championships, maybe in football, in basketball, in sport works for workers? And do you have like a country that you choose to organize events, championships, which you just indicated?
It is organized, it is the same way like in civil sport. We have national associations in each country. The country apply for hosting the event. We award the event. We make a preliminary visit to see all the details, to review all the details on the staging of the event. We invite the National Association. They invite teams in their country interested in participating in the events, and the events happen. That's how we had for this mandate going to its end. We had AfriSport, that are the African Workers and Amateur Sports Clubs, in 2022 in Algiers, in 2023 in Banjul. We had the All Africa Game of Workers, the second edition, in Dakar, Senegal, in 2024, and we plan now our fourth edition of the African Workers and Amateur Sports Cups in Algiers, where also will be held the Continental Elective Congress.